Good afternoon. Welcome to today's webinar from the Mary H. Weiser Food Allergy Research Center at the University of Michigan. Our monthly series was created to help patients and their families cope with the social and emotional challenges of living with food allergy. I'm the clinical social worker on staff at our allergy clinic. I work with our patients and families to provide tools to manage food allergy related anxiety and navigate all the challenges from diagnosis through transitioning to living independently. My role was established through a gift from the Weiser Center, where advanced biomedical research into the origin and treatment of food allergy takes place every day. Founded only 5 years ago, the center was recently named a Discovery Center of Distinction by the advocacy group FAIR and added to its prestigious network of research institutions. Our clinic is only one of a handful nationwide with a multidisciplinary team, including a full-time counselor and dietitian. Visit uofmfoodallergy.org to learn more. Send your questions today using the Q&A function. We'll be answering them throughout, and we want to hear what's on your mind. Today, our focus is a more serious one. We really thought it was a good opportunity to look at mental health and accessing mental health care, how today's stressors are impacting adults and children, and how you as parents or you individuals living with food allergy might be impacted with stressors that you already had, things being exacerbated right now. So we're going to talk basics about what are indicators that mental health care or behavioral health care might be helpful for you at this point. How to determine insurance benefits, because that's always confusing, where to start to try to figure out what I'll pay, what my insurance will pay, how to find someone to see. And then we're going to circle back to look at the specific needs of our food allergy population and talking about the benefits that you get from working with a food allergy informed counselor to deal with the skill building, being a person living with food allergies. So we'll look at that continued skill building and why it's so important even in this context of the pandemic. So as we know, 2020 has brought many competing stressors. People are reporting that their mental health is suffering now more than ever. They're feeling a mix of emotions during the pandemic. And we know both adults and children are reporting increased symptoms of anxiety and depression. Unfortunately, as we know, we've lost 400,000 lives in the United States to date. More than 2 million worldwide. We're living in a time of social and political unrest and change. People are doing remote learning and working, which creates, so change is very stressful for people. Even if some aspects of a change can be positive, change itself is very stressful. We're all dealing with some type of social isolation right now. The things that were available to us normally are not. So from our youngest children to our seniors are all dealing with loss of that connection, loss of in-person contact, inability to do the things that we used to do for our stress management. So seeing people, celebrating, getting together, making plans, things to look forward to. People are talking about experiencing a great deal of fatigue, a sense of just monotony. They're feeling like they're maybe doing more, but within the walls of a more confined space and feeling worn down. A lot of people have dealt with real financial stressors, job changes or job loss. And it's an ongoing. So we know as humans, our brains are built to adapt to immediate change. But our brains are not built to adjust to long-term uncertainty. That creates a lot of anxiety. And uncertainty makes us feel more fear. And we start to experience more maybe challenges around feeling like we can cope with everyday demands. Parents are talking about feeling so pressured by the demands of homeschooling and doing their remote work and feeling like they can't ever get enough done and nothing's going well. I talk to a lot of kids about remote learning, and the thing, of course, that I hear, I miss my friends. I miss seeing my teacher. They're worried that they're not understanding the material as well. They're not always sure what's being asked from them. So they fear not doing well. In addition to, I'm not getting to see my friends. I'm not getting to go to recess. I'm not getting to see and catch up with all the people that I care about. They're not able to do their sports right now. And as we'll talk about later, there's been a lot of milestones that, you know, we usually celebrate that kids have missed out on in the last year. So we certainly typically have traditions and celebrations for things like graduations or first year in kindergarten, or maybe senior year of high school, or what being in college you think is going to be like. And all of that's been turned on its head. So that is impacting our younger, from our school-aged to our university students. A lot of kids who have graduated have not been able to go out into the workforce, so they feel in limbo. I'm talking to a lot of young adults who feel, you know, when am I going to get my chance? Job hunting is really hard right now, and I feel stuck. So to some degree, everybody's dealing in their own way with these competing stressors. So let's talk about what this disruption of routines and change might look like. What might you experience? So some of the things we look at, and this applies to both young people and adults, signs that you might be suffering: low mood, anxiety, difficulty sleeping, irritability, loneliness, feelings of helplessness or hopelessness, overwhelm. So let's look again at some of the numbers that are captured by the CDC and the National Alliance on Mental Health. So just also to let you know you're not alone. You know, if you're feeling any of these things, or if you think your kids are experiencing these things, I want you to know that most people are experiencing some degree of real symptoms of anxiety or maybe depression. So 1 in 5 Americans already lives with a mental health condition that they're aware of, that's been diagnosed, and that was pre-pandemic. The CDC recently did a survey, and this was with adults. 41% reported symptoms that we would consider to be related to anxiety or depression. 31% really are experiencing new trauma related to what they've experienced in the pandemic. So either loss of people they love, or their own illness, or fear of exposure, or maybe again, financial instability, fear of the foundation, the stability of life being lost or changed. And 26% of people did report that they've started to either increase their substance use or started to use substances to cope, as a way to just be numb, to not have to feel. And really relevant for our population at the Allergy Clinic, 3 of 4 people between 18 and 24 report that they're experiencing a lot of mental health symptoms new to them during the pandemic. And 1 in 4 report that they've actually had thoughts of suicide or self-harm in the last 30 days. So I want to frame this for us because I think it's such an important time right now to look how we recognize symptoms, how we get help, how we talk about these things, so we know how to access help and we don't feel like we're alone. So mental health is everyone's right. Mental health is just as important as any other aspect of our physical health. And oftentimes it gets overlooked. We might put more emphasis on aspects of our physical health and maybe feel less comfortable bringing up our concerns about our mental health with our primary care provider or with family or friends. So often people might be suffering in silence. And it's very important that we know, what are the symptoms and can I get help? How do I get help? So when to seek help? So some of the symptoms that I had mentioned, as people experience, can we look at the next slide, Melissa? Thank you. So people have reported 8 groupings of symptoms. Overwhelm. I mean, how many of you are feeling extremely overwhelmed by managing all the multiple aspects of daily life right now? Whether you're parenting, whether you're taking care of other people in your family, whether you're just taking care of yourself and managing all of the aspects of daily life, that feeling of overwhelm is more commonly being expressed right now. That fatigue. So kids keep telling me they feel, the Zoom fatigue that adults are feeling. They're in front of a screen all the time. They're trying so hard to pay attention and concentrate, but they might be feeling like that's harder. Kids that have attention difficulties prior to the pandemic are really struggling with this ability to stay attuned and to stay on task. And so fatigue for all of us, and looking at how are we coping with that? Do we recognize that as something that we can help ourselves with? So if you're noticing an increase in rage or anger, and I am hearing this with parents expressing that they're observing some anger, irritability, impatience, low frustration tolerance with their kids, and it's new behaviors. And I think we need to see that within the context of that's part of what mental health suffering can look like, is that feeling of really just not having any tolerance for one more thing or another stressor, any tolerance for being asked to do anything or learn something new. So this tension often comes out sideways. And so we might see that with rage or anger, but people tend to not see those things as indicators of anxiety and or depression, but they really are. I'm also hearing from people that because they've had to be isolating, keeping to themselves for so long now, we're going on a year, that they're starting to feel a lot of fear about going out in public. They feel less comfort around being out and about, whether it's they had to go grocery shopping or whether they're even doing a Zoom call with friends. I'm hearing it expressed that, it's just sort of, I don't have the energy for it. And I notice I just want to kind of withdraw. And so agoraphobia is, a real fear of being out among people, being away from your comfort zone, which for most people right now is their home. So for people who already were dealing with a social anxiety of any kind, being away from people, being at home, now might have really exacerbated their discomfort with needing to go out and connect, communicate, interact. And so even the smallest of tasks, people telling me I had to go out and get groceries and I had to leave. It was just so overwhelming. And it's not just a fear of exposure to the virus, but really my anxiety just went through the roof. It feels like I'm kind of out of the habit of knowing how to interact and connect with people. And that's really making people uncomfortable. Is this how it's always going to be for me? It didn't used to be this way. but it is something else that we're seeing. So as we continue with groupings of symptoms, anxious or intrusive thoughts. So if you find yourself the majority of the time experiencing worry thinking, that it's very hard to, distract yourself from, and you're just feeling pulled back into sort of an anxiety loop over and over and over. That's something to pay attention to, and really notice, has it always been this way for me? Is this new? Is this maybe something I'm noticing more of lately? And just to take note, we want to be good observers of ourselves, because it's information we can use to help ourselves and to realize we can get help and receive support. Apathy, I'm talking to a lot of people and reading a lot about people who report, I just don't feel motivated. I don't feel as much excitement about things, or I'm kind of struggling to find joy in the everyday. And I think, at first, if you were fortunate enough to be able to remain safe, remote working, and your children were able to do homeschooling, you were able to support that. And so at first it was, people were doing puzzles. There were a lot of board games being sold. People were doing hobbies. They were doing home projects. Now, a year later, more and more, there's just sort of this sense of, okay, we thought we were only going to be doing this for a while. Now this has gone on, and it's hard to get excited about anything. A lot of feeling of kind of having to just keep going and maybe push through the day. So that is something to notice too, because we want to find ways to find joy and excitement, even in the context of, the stressors we're experiencing right now. If you're experiencing hopelessness or helplessness, those can be important things to look at. And social withdrawal. So choosing to kind of keep to yourself and not interact even with maybe the people in your household, or by talking by phone, or not returning texts, avoiding emails, this kind of wanting to wall yourself off more than necessary. So those are all things we can pay attention to. So we want to know if those indicators that there might be something for me to pay attention to. And then how do I get help? What are the basics about how to proceed from there? A lot of people have never talked to a counselor or therapist, and so they're unsure. What are the first steps? So one of the things you can do is, if you have insurance, you can call the customer service number. And what you want to ask is, what is my in-network deductible? So there's 2 tiers of the in-network benefits and out-of-network. And ideally, you want to find a therapist that's in network with your plan. You're going to get the best benefit. You are going to pay the least out of pocket. So the words you want to use are, what is my in-network deductible for mental health, or sometimes referred to as behavioral health care. So often, if you look in your insurance information, it might say benefits for behavioral health, and it's outpatient. And the things to look at is, what would I pay out of pocket? What is going to be my copay per session? So if you have a deductible remaining, so some people have really large deductibles, and that concerns them. So if you have a $6,000 deductible, let's say, you're going to pay out of pocket to be able to access services until you meet that deductible. If you have a lower deductible, you're just going to pay a copay. So if you do have a large deductible, though, how do you access services? So we're going to talk a little bit more about that. For people that it's out of reach because you have insurance, but the out-of-pocket cost is still going to be too great. In every community, there are some options for reduced or sliding scale fee. There's also some great resources right now for just, you can get support through text, through the crisis text line or through a support line. But let's keep talking about the insurance. So when you find a provider, the important thing to ask them is, are you in network with my insurance? So this is my insurance, and are you in network? But you always still want to check it out for yourself. And you can ask them for their NPI. So it is their provider identification number. And the insurance is going to ask you if you have that. So because they need a way to look up the provider and see, is this person truly, paneled with us? So if you see them, yes, you'll get in-network benefits. So the NPI, and you can ask the therapist, do they do the billing? So some therapists do, they bill, and then they'll bill you for your out-of-pocket costs. Others will say, no, you have to pay up front, and then I'll give you a statement, and then it's up to you to submit that. So you really want to know, and ideally, it's helpful to have a therapist who is billing and working with your insurance company, so you are not paying up front and then trying to collect that money, because that's also out of reach for a lot of people, to pay the full cost up front and then wait to be reimbursed. So also, right now, a lot of therapy is being done virtually. So we refer to it as telemental health or telebehavioral health. So it used to be you had to see a therapist face-to-face, or there wasn't coverage. But now all of the insurance companies really opened up the plans to be able to allow for virtual care, understanding that people needed access and cannot, attend face-to-face. Most therapists are still only doing virtual care. We don't know when that will change, but the hope is, it has been extended, and the hope will be that the therapists or that the insurance companies are going to adapt, and that to some extent will always be part of your benefit. So that's being lobbied for, and certainly it's opened up a lot of access for people who live in areas where they don't have a lot of therapists, and then they can see anybody in their state. So especially for kids, it can work around their schedule. It's not, they don't need someone to drive them. It just has opened up a lot of services for people. So ask, if I see someone virtually, is that paid for? Is there any difference in what you'll reimburse? So then going back to how to find a provider. One of the things I encourage people to do is include some conversation about how you're feeling emotionally with your primary care provider. And if you feel you can't do that, you might really want to look, is that just that it makes me feel vulnerable or uncomfortable, or do I find this person not kind of receptive? Because ideally, you need to see a primary care provider that is looking at your holistic well-being. And certainly your emotional and mental health is key to your overall well-being. So you might think about telling them, I think, I'm really struggling right now, and I've never seen anybody, but maybe it would be a good opportunity. And then they may have ideas. Oftentimes they have providers they can refer you to, or places where they know you can get more information. So Psychology Today has a tool called Therapist Finder. So you can just go on Psychology Today, and then there's a directory for therapists. You can go to your state, because a therapist is limited to seeing people within the state that they're licensed. So if you are in Michigan, your feet are in Michigan, you need to see somebody who is licensed in Michigan. I'm licensed as a clinical social worker in Michigan, so the scope of my license limits me to only providing services to people who are currently in the state in which I'm licensed. So, you need to be conscious of that, because you need to look for a therapist who's somewhere in the state. So going into Psychology Today, you can filter by, do I want to see a person who specializes in cognitive behavioral therapy? Am I looking for play therapy? Am I looking for somebody who's really knowledgeable about chronic health issues? You might see things around so if you have food allergies, you might want to look for somebody who talks about experience dealing with chronic health issues, or people who have health-related anxiety. They may be more likely to have worked with people with food allergies and understand more of what the context of your concerns. But this is an excellent tool because it's often difficult to know where to start. Do I just Google therapists in Ann Arbor? And you're going to get loads of names. But this is a tool that allows you to see their profile, how they practice, where they practice, what insurances they take, and of the scope of the care they provide. What are the ages of their clientele? It might say whether they're taking new patients or not. So check the approved list of providers on your insurance website as well. They may have, but sometimes those are not up to date completely, but it can be a good place to start. And look for word of mouth. People who have had good experiences with counselors, so therapist or psychologist, and that's a good place to start. So did they find somebody that was really easy to talk to, that was extremely helpful, really reliable, and they feel they gained a lot? So through word of mouth is a great way when you're looking for trustworthy sources of help. So let's really talk about a couple issues that, in terms of our food allergy community, we're in a situation in which people are having difficulty kind of practicing the skills that they need to be able to move into greater independence, because they're not dining out, they're not spending time at friends, they're not at school. Kids are going to start to go back to school here shortly, but they've been at home. They've been remote learning. So their need to sort of develop skills and manage worry and stress about eating away from home, that has been kind of postponed. And we want to look for ways where we can continue to advance those skills. So we have a question from the audience. 11-year-old who's going through OIT right now. So this 11-year-old is experiencing some kind of increased worry and unsure whether they're having food allergy symptoms, and the parent is kind of unsure what to make of that. And she asks, would this be a good situation in which to seek out a food allergy counselor? So I say definitely. Anytime kids are going through any kind of treatment for their food allergy, it always ups worry, kind of brings up new anxieties and concerns, and requires new skills to get through that. So it's a great idea. So if you are not part of a practice, an allergy practice, in which they have a counselor on staff, you could go to, on our resource list, you'll see there is a food allergy behavioral health directory put together by Tamara Hubbard, who is a counselor in Illinois. So she recognized this need to have the access to food allergy knowledgeable therapists. And so she has tried to vet these therapists and then include them so that anywhere you are in the country, there is somebody that you can talk to who specializes in food allergy. So definitely, it's a great opportunity to look at skill building and to begin to differentiate between symptoms of anxiety or worry and symptoms of a reaction. And that's often a struggle for our population, because there can be some overlap in the physical, what the physical sensations of anxiety and the physical sensations of a reaction. There can be some overlap there. So it can be tough sometimes to know, what is it I'm actually feeling? And then worry goes up. But this is an excellent opportunity. So if you do not participate with an allergy clinic in which they've talked about having that multidisciplinary team on site, certainly you could look where is within your state on that directory, who could you check with to see if you can do some virtual care, and specific around developing these new tools to manage both the stressors that are going on right now and the ability to continue to proceed through OIT, and for your daughter to gain that perspective that will be helpful in her navigating them. We have another question regarding like a multidisciplinary approach for food allergy. This person asks if we have a dietitian in our clinic who works with patients, and we do. We're lucky to have a fabulous dietitian. She actually, participated in one of our segments a few months ago, and Liz Hudson works closely with our patients who have IgE-mediated food allergies and or FPIES. So we are fortunate to have a very well-informed dietitian who works on our team and is available to all of our patients. Liz, however, is able to work with patients or with people who are not patients of our clinic. So if you contact the allergy clinic and let them know that you are interested in talking with Liz Hudson, but you're not a patient of our clinic, they can put you in touch with her so that you can look at scheduling. So even if you're not, your primary care physician is not through Michigan Medicine, that would still be available to you. We had another great question about how the form of delivery of behavioral health care. And this parent asked, have we considered offering group virtual sessions instead of one-on-one for kids with allergies, because they would gain that benefit from peer support. And in the past, there has been a group, it was in person, and we've, now that things are continuing to be kind of in this virtual format, and many of us able to work with clients only remotely, we are looking at virtual sessions. And I would love to hear from people if that is something you think that you would be interested in participating in. Would your kids be interested? Would that be something that, a way in which they might feel more comfortable engaging? I do think that there's a lot to learn from hearing other kids talk about kind of the challenges that they dealt with, the way that they handled it. They can encourage and support each other. It's a confidence builder to know you're not alone and that other kids are dealing with the very things you are. So just like mental health as a whole, one of the reasons we want to talk about it and have it not be an invisible issue, an invisible suffering, is we want to normalize it, and we want people to know others are experiencing what you are. It is not abnormal, and we want to find the words to be able to speak out so we can get help. So Melissa is sharing the directory I referred to, so you will receive this in your email. So it's foodallergycounselor.com, and it is a wonderful reference across the state. So let's swing back to looking at, so we've kind of laid out this foundation of what we're dealing with generally. Well, then thinking about anybody who has specific health-related issues that they're already managing. So we know any additional stressor exacerbates our stress around things we're already managing. So in our case, the people that we see that have food allergies or they have asthma, they're already dealing with some level of uncertainty and kind of difficulty, just in day-to-day life, some uncertainty around exactly what they might experience. So we know we're seeing in the clinic more anxiety because of the pandemic. So what happens at a food allergy counselor appointment? For those of you who have not met with me or met with somebody else, let's just break down, what does that look like? Because even getting kids to agree, it's helpful for them to understand why they would do this and what might happen if we were to meet. So every time I meet with parent or involved adult and a patient, whether they're 5 or whether they're 15, I screen for food allergy related anxiety. So that might look like, and we have a screening tool that we use, and this will be on our blog this week. So we screen for how disruptive is food allergy, is that food allergy having on your life right now. So at 5, that's going to look different than at 15. So we look to the parents, what is their own level of stress? So for example, are they replaying past reactions? Are they finding it very difficult to be able to get that out of their mind, and that is very triggering and makes them feel very afraid about doing things like having their child go back to school. If their child ever had a reaction at school, I'm talking with parents who say, you know, I know we can't stay in this kind of bubble, but in some ways it's been kind of a relief to know that they're here with me. I'm managing all of their food. They're in this kind of safe environment, and we haven't had any reactions, and everything is so well controlled. But they also know that they don't want their child to have to live like that forever. We want kids to be able to gain the skills that they need to be more independent and to feel confident and competent. So we understand that people have gotten kind of out of the habit of having to step out of their comfort zone with some of these things. So I always look at, are there things that they're avoiding? So in regular non-pandemic life, we look at things like, do people avoid dining out? Are kids avoiding eating foods that have been deemed safe for them? So are they limiting their diet in ways that they don't need to, or becoming at all food averse? Talking with parents about, is my own stress level very high in terms of like the fear I have about my child's food allergy? Do we avoid things as a family because of fear of a reaction? So we look at that as like the parental burden of food allergy, and how high is that emotional burden that the parents are experiencing, because we want you to have the tools that you need to be able to recognize your stress and deal with it in ways that help you to feel calm and able to just continue to be in everyday life. If you're ruminating on past reactions, that is definitely going to impact what you see as possible in the future. So you'll be more inclined to want to stay in a comfort zone and not maybe have new experiences, because there is this fear all the time of, what could happen, and I don't want that to happen again. So we're just not going to go to restaurants anymore. But we know, we've talked about in past webinars, if we use avoidance to manage anxiety, we will end up with more anxiety and less confidence about our ability to handle discomfort. So first thing we do is a screening, kind of what's happening developmentally at this point in time, and identification of current developmental challenges. So is there a 5-year-old getting ready to go to school full time? And what do they need in terms of being ready to be around kids, eating maybe at an allergen-free table, communicating with kids about their allergy, understanding and trusting that other adults will have their epinephrine auto-injector and that they will be there to help them. So that is on the patient side. But then for the parent, they could be having a lot of feelings about they're going to be at school. Will school be equipped? Will they be paying attention? Can I really trust that my child can be safe at school? So what are both the involved adults and the kids feeling at that point in time? What are the stressors about new things that they're getting ready to do, or things that are going on right now? So for example, if they're getting ready to go to summer camp that year and they've never done that, they've never slept away from home, they've never had to eat away from home, getting ready to do that. We want kids to be able to have all of the best opportunities and experiences, and we don't want them to be limited by having food allergies. So what we do is look for sort of areas where we can strengthen skills so we can develop confidence and a feeling of competency, both for the adult coach, the parent coach, and the child. So we do a lot of practice. We do role playing. We play out scenarios. We have real world situations in which we look at problem solving and planning. How would I handle that? What would I do? So what would that look like? And we just walk it through. And it really does help normalize those situations. And once they can see their way through it and see themselves being able to navigate it, the confidence is increased. So when I meet with kids right now, it's virtually. We're doing a lot of looking at, has there been a new reaction? I ask them to tell me. So oftentimes we'll role play. I'll say, okay, I'm going to be the person. I might be the person who has the food allergy, and I want you to watch and tell me what you think is happening. And we really always want to reassure that they can recognize and treat their reaction. So would I know if I'm having a reaction? What might it look like? What might it feel like? And what would I do? So it's always reassuring and reinforcing that you can cope. You can recognize, you can get help, you can be safe. So if I'm meeting, oftentimes I meet with an adult and the young person. So I'll have the adult play that out. So they just ate something and they'll say, my throat feels scratchy. I wonder what's going on. I'm not sure what's happening. Oh, I think, my lip is swelling. So, and to talk through what are symptoms that might show up and what would I do? How would I tell somebody? And what would happen next? So we talk about using the epinephrine auto-injector. We talk about where they're at in terms of stress around that. If they have fear, if we need to work through some of that using the trainer more often, practicing by having a trainer party with friends, or in getting ready to go back to school. This is a great time to talk about, okay, walk me through. What might you feel if you had a reaction? What might you do? So show me. So for our older kids, show me. Let's practice so that you can begin to learn how to give yourself your medication. And let's keep talking about that until you feel really confident that you could do it without thinking twice. A lot of parents talk about, I'm not sure if my child is feeling anxiety some of the time, that they're worried that they have a reaction, or would they be able to differentiate between a food allergy reaction and anxiety? Because like we talked about, there can be some overlap in how those two things feel. So anxiety can make my stomach feel queasy. It can make me have dry mouth. It can make me feel kind of nervous or shaky? Well, the stomach, yes, we can have nausea or discomfort when I'm having a food allergy reaction, and anxiety. But dry mouth is not one of the things really that we identify as a symptom of a reaction. And we might feel like flushed with a reaction, and that can be something people feel with anxiety. But starting to just shake, that might be more anxiety. So talking through, what does anxiety look like and feel like? And what does reaction look like? So let's talk about, because it's normal to have an increase of worry or anxiety when you're doing something new, like eating out, going to a friend's house. If you're on campus as a new college student, experiencing some nervousness because it's unfamiliar food, unfamiliar setting. So our goal and the benefit of counseling with a therapist who's a knowledgeable food allergy therapist is being able to know that you have the tools, that you can talk back to your worry thinking. You can develop helpful self-talk. So on a day-to-day basis, I can look at what I'm saying to myself. I can challenge things that aren't true, that aren't accurate, and I can develop some reassuring, helpful talk that will help me be able to handle whatever situation I'm in. So I see a question from our audience. Thank you. Do you know any therapists in Phoenix who deal with chronic health issues such as food allergies? And I would highly recommend, I don't know any personally, but I would recommend using the resource, the Food Allergy Behavioral Directory, and look in Arizona to see. I'm sure that there are providers, and how could you access help and reach out? Another question, thank you. Everyone in our family has many of the symptoms you describe after a year of COVID and food allergy. How many members of the family can be seen in one visit to a counselor? And so I'll sometimes, and whether it's in person or by Zoom, we can have all the members of the family be seen. So a therapist will certainly meet with the family, because health issues, they affect everybody in the family. So the person who is like the designated patient, but then the adults are experiencing something different in relation to that. Siblings certainly experience their own, they have their own experience of that, living in a household, having a sibling, maybe witnessing reactions, some things that maybe the family can't do, or some food isn't in the house because of their siblings' food allergy. So to everybody having the chance to talk about what is it like for them, what's on their mind, what is stressing them out, and kind of how are things working as a family. So definitely I would look, one of the things I would look for when I reached out to somebody is, at times, can we involve other family members so you can help us facilitate conversations, because we've all been in this together and we're all stressed. People are talking about having a lot of relationship conflict and tension. People have been, together a lot and feeling, these changing roles and demands and responsibilities. And that's not always pretty, Stress means sometimes we don't get along, or we might be having, like I talked about, we might be irritable, we might be less forgiving, we might have difficulty in being able to tolerate one another. So at what age do I see patients without the parent present? So that's kind of, case by case. So if the parent thinks that maybe the patient would talk more if they weren't present, what we sometimes do is I can talk with with the young person, and then have the adult join us. So maybe at the beginning, and then they leave for a while, we talk, and then maybe they come back in at the end. And because that gives me an opportunity too to talk about, okay, we've talked about these skills that we're going to practice, and these are some real life ways in which I want them to practice this week. So these are some ways I want you to encourage them to do that, because parents need that information. They need to know, how can I help manage their anxiety? What should I be doing in response to that? What if I see this happening? How do I respond? So it is good that we can all talk. For older kids, often I meet with them by themselves and invite the adult in maybe every other session or every few sessions. What about extended family, grandparents, etc., who aren't cooperative with food allergy restrictions and management? Absolutely. So I do have some great resources that you can reach out to us if you're interested in ways to communicate with extended family, because of course not everybody has a really good working knowledge of what food allergy really is, the life-threatening nature of food allergy. They might think of it more as a food intolerance or a sensitivity or by choice. And so I do hear about those tensions quite a bit in families, and I have some great resources to point you to that you can read to help your own communication, but articles you can share with extended family, and if they're open to looking, to help grandparents understand the reality. Because we've had a vast increase in food allergy diagnosis, and so grandparents are often unfamiliar. They don't know anybody with food allergy in their generation. Their kids didn't have food allergy. So we need to be understanding that we don't know how to handle things that we've never been educated about. And a last question: how often do you see a patient or family? So that might really vary. So if I'm seeing somebody who is experiencing a lot of anxiety or depression right now, as well as food allergy, I might see them weekly for a few weeks, and then maybe as they're stable and feeling like they can practice some of their skills, and then we might move to every other week. So in my role at Michigan Medicine, it's more of a brief model. If somebody needed more longer-term work, I would help coordinate that so that a person could transfer to a community provider and continue to do more long-term therapeutic work. So thank you very much for everybody who tuned in. We want to keep hearing your questions. Please send us emails. Please reach out. What are webinar topics you'd really like to see us do? If your child would be really interested to be a participant in a Zoom group, I'd love to hear that, because I'm really willing to do that, and we would love to know if we could get enough kids to be able to make that happen. So maybe in terms of a younger group, and then high school young adult group, because the issues are very different. So please stay with me while we move into a brief meditation. We have about 4 minutes left. So our next webinar is February 18th. Please save the date. If you were with us today, you will get an email reminder about our next webinar. And we'd love for you to share this. Share it on your social media. We're trying to reach people across the state so they can have this information and realize that they can get support, even if they aren't receiving that like multidisciplinary support through their own allergy clinic that they're able to access. So part of our goal is to serve to be supporting and educating and being there for the food allergy population as a whole and across the country. So certainly reach out to us. We'd love to hear from you. So let's take a quick shift from our thinking mind. Just let's drop down into our body. So as you're sitting, Push your feet into the floor. And just take a deep breath, imagining the air coming in through the top of your head, moving down through your chest, your stomach, and out, down your legs and out through the soles of your feet. Let's just slow down our breathing and do that again. Coming back to connect, just feeling the rise and fall of the next breath. As your mind wanders, just coming back again and again. Mindfulness is really about coming back to the anchor and the anchor of the breath that brings us back to the present moment. So out of future thinking and out of thoughts about the past, just coming back again and again to this moment where we're sitting here together